There's some truly terrible diseases plaguing humans today. And then there are some whose clinical presentations itself strike fear in the heart. This week we'll unpack one such disease, a disease that dates back way beyond modern civilization, a disease whose characteristic features have invoked disturbing images of disfigurement leading to the unshakable stigma associated with it. Yes, we are talking about leprosy. Even today, the term leper is often used as a synonym to a social pariah or to someone shunned from society for social or moral issues. Welcome to this week's episode of Global Healthcare Archives. The ancient Egyptians considered leprosy as a curse from the gods and a punishment for committing sins. This led to lepers being isolated in leper colonies away from civilization. Despite the numerous medical advances, little seems to be known about the exact pathophysiology of leprosy, and it continues to remain a public health challenge in developing countries like Brazil, Indonesia, and India, among others. These three countries, in fact, alone account for 80% of the global disease burden of leprosy. I'm fairly certain each one of you have been exposed to a set of myths and misinformation regarding this disease. So let's have a look at the basic facts for a better understanding. Leprosy is an infectious disease caused by a slow-growing bacterium called Mycobacterium leprae. It was discovered in 1873 by G.H. Amer Hansen, and therefore it's also known as Hansen's disease. Leprosy primarily affects the peripheral nerves, leading to a loss of feeling in the limbs, painless foot ulcers, and muscle weakness. It also affects the eyes, which if left untreated may lead to blindness, and the mucous membranes of the nose, which may lead to nosebleeds. The main symptom of leprosy is disfiguring, pale-colored skin sores. Depending on the type and the number of skin sores, leprosy can be classified into the following three types. Paucibacillary or tuberculoid leprosy, which is a relatively mild form of leprosy with patients exhibiting only one or a few patches of flat, pale-colored skin sores. Multibacillary or lepromatous leprosy is a more severe form of leprosy, exhibiting widespread skin patches or rashes, muscle weakness, and numbness. And finally, borderline leprosy, where patients exhibit symptoms of both paucibacillary and multibacillary forms. Contrary to popular opinion, leprosy is not highly contagious, although multibacillary leprosy is more contagious than paucibacillary. Approximately 35 to 70% of infections are resolved without the complete onset of the disease, pointing towards an ethological relationship between the type of bacteria and the immune condition of the patient. Interestingly, it cannot be spread by casual contact with an infected person, as the bacterium is unable to penetrate intact skin. Thus, activities such as hugging, shaking hands, or sitting next to an infected patient do not transmit the disease. Additionally, mothers with leprosy cannot pass it to their babies. As Baba Amte, the man behind Anandvan, a community rehabilitation center for patients with leprosy, said, "Joy is more contagious than leprosy." However, the disease may spread through the droplets containing M. leprae bacteria when a person with leprosy coughs or sneezes. And yet, little is known about the exact pathogenesis of how the disease spreads. One of the possible reasons could be the long varying incubation periods of the bacterium extending from 5 to 20 years. This makes it difficult to pinpoint the exact place and time of the infection. However, there is some light of hope. Besides little being known about the pathophysiology, leprosy is treatable. The WHO recommends a multi-drug therapy as an efficient treatment for all kinds of leprosy. This therapy comprises the medicine dapsone, rifamycin, and clofamizine, and is available free of charge to all patients worldwide since 1995. MDT is recommended for 6 months for paucibacillary and 12 months for multibacillary leprosy. Incidentally, scientists at the University of Hong Kong and the Sanford Burnham Prebys Medical Discovery Institute have identified one of these drugs, clofamizine, as exhibiting potent antiviral activities against SARS-CoV-2. It helps prevent the exaggerated inflammatory response associated with severe COVID-19. Now, this drug is undergoing phase 2 trials for use as an affordable at-home COVID-19 cure that is safe and easy to manufacture and can be made available worldwide very easily. Of course, going by the adage, prevention is better than cure, a vaccine against leprosy would definitely fast-track the eradication of this disease. So why hasn't that been discovered as yet? Well, one reason might be the lack of reliable tests to detect infection and simple biomarkers to predict vaccine efficacy and the treatment response. Second, vaccine efficacy trials are marred by the long incubation period of leprosy and the vaccine production by the inability to culture M. leprae in artificial media. Exposure to environmental myobacteria with cross-reacting antigens to M. leprae could modify the immune response post-vaccination and thus alter the protective efficacy of the vaccines against leprosy. In 2016, the WHO launched the Global Leprosy Strategy 2016-2020, accelerating towards a leprosy-free world which focuses on the following three core pillars. Pillar 1, strengthen government ownership, coordination, and partnership. Pillar 2, stop leprosy and its complications. And Pillar 3, stop discrimination, promote inclusion. Due to the strategy involving the widespread administration of MDT and the prevalence rate of the disease has dropped by 99%, from 21.1 cases per 10,000 people in 1983 to 0.24 cases per 10,000 people currently. World Leprosy Day is now celebrated on the last Sunday of January, which has helped spread the awareness regarding this disease, leading to an early recognition of the disease and reduced stigmatization. While various national and international organizations such as Anandwan, International Federation of Anti-Leprosy Associations, Sasakawa India Leprosy Foundation, and others are working for eradication of leprosy, more attention needs to be paid to the first two pillars. But it's equally important to focus on the pressing need of stopping discrimination against patients. Even the theme for World Leprosy Day 2021 was Beat Leprosy, End Stigma, and Advocate for Mental Well-being. It is a fact that battling the disease is not just a physical or a physiological matter, but also a test of mental strength. A patient's mental strength, ability, and will to fight plays a substantial role in conquering a disease, and often one derives that strength from the support of those around them. As the Padma Vibhushan awardee and winner of the Gandhi Peace Prize, Baba Amte said, "I sought my soul, but my soul could not see. I sought my God, but my God eluded me. And then I sought my sisters and my brothers, and in them I found all three." Well, that's it for Global Healthcare Archives this week. Look forward to seeing you all next week. Till then, stay safe and stay informed.